coming up.
This is News 4 at 6.
And good evening, everyone. Thanks for joining us tonight. I'm Joe Hart. Topping our newscast tonight, we have a follow-up on cuts made to a child care assistance program. Only on 4 tonight, we now have more answers as to why the state is cutting more than 5,000 children from its child care assistance program. Now, after more than a month of asking, the administrator for the program sat down with our Kim Burrows for this On Your Side report.
The state provides child care subsidies for low-income families.
I think it's extremely beneficial. I myself was on child care assistance.
Lisa Swearingen is the deputy administrator for the Division of Welfare and Supportive Services, who says COVID money once paid for 13,000 kids to receive child care money.
So what happened when the COVID money ran out?
We've had to get back down to the norm.
And that's hard for a lot of families to hear that news that they're now no longer on the program.
We've had some of the parents, not a lot of conversations with parents. I know that a lot of them are just thankful that they had the 3 years of help. We haven't had a lot of complaints.
But we heard from lots of people who were upset that they had one of the 5,500 kids getting eliminated on the program. Like Heather Paley, who we've been reporting on. She received state child care assistance for her 4 grandkids. Paley's $1,200 take-home pay every 2 weeks was barely enough for the family of 5 to survive. She figured her raise would help, but in fact, the state, through the federal guidelines, said she made too much money and took away her assistance. She says she only had 2 weeks' notice of the change.
Fear. I was very fearful, because I can't afford $2,200 a month.
After our stories, Paley said the Children's Cabinet, who managed her account, reevaluated her case and reinstated her assistance.
But there's been, as far as you know, there's been no discussion to say before they're completely cut off from the program. Maybe they get half assistance and then no assistance.
So, no, we haven't really looked at that.
People making 85% of the state median income used to qualify for child care assistance, but October of last year, the number was cut almost in half. Now, for renewal applications, people now have to make at or below 49% of the state median income, 41% for new applicants. The state says the drastic drop is needed to make budget for the federal grant it receives.
So most of our budgeting is based on the federal rules and the federal guidelines.
And in a big change for the state's child care services, the cases will now be managed in-house under Health and Human Services. The changes will take effect June 30th in southern Nevada and in 2026 in northern Nevada. That is expected to save money, which will allow more kids back on the program. In the newsroom, I'm Kim Burrows.